1917. America's children. Its future. Worth less than nothing. Discarded. Put to work. Forgotten. Ultimately hopeless. And yet on the streets of Omaha, one man saw the need for change. Father Edward Flanagan knew the future of our country would depend on our children. He started a revolution through Boys Town, and his vision to change the way America cares for children brought life and hope to America.
When I came to Boys Town, I found it a magic place. You know, kids, I had never met a black kid, never met a Mexican, never met a Jewish boy. And we were all friends, you know, we worked together, played together, fought together. And it was just it was a melting pot, really. And Father Flanagan taught us very, very carefully, differences are not divisive, they are enriching.
This vision of one America working for the future of all our children was groundbreaking. And yet, at the time of his death, the future of Boys Town was uncertain.
He saw very clearly that if he was going to build an organization, a home for children, that also was about structural change, it had to continue after he died. So the famous quote by Father Flanagan is, "The work will continue, you see, because it is God's work and not mine."
And it has continued. In the years since Father Flanagan's death in 1948, Boys Town grew. It adopted the family teaching model, which modernized Boys Town's system of care. It began serving girls and expanded nationwide. Ultimately, Boys Town refocused its efforts to include not just kids, but also families, bringing Father Flanagan's vision of care to millions of children and parents. Today, Boys Town is one of the largest child care organizations in the country.
It's the most researched residential model in the world. We have a longitudinal study of over 20 years for our campus kids, which tells us that our kids are good citizens. Our model works because we know it from a quantitative standpoint and a qualitative standpoint.
So research has been with us from the inception of this program, but also research is what gave us some of our other programs. Common sense parenting, in-home family services, care coordination. All of those programs we built with a research effort as well as a practice effort. We're very unique in that fashion. Universities research ideas, we research solutions.
And these solutions have been groundbreaking.
So we help the families through, it's called in-home family services. We call them preventive services in New York. We teach the parents how to parent their children, how to give consequences, how to be able to teach themselves. Because if we were just to teach the child, as soon as we remove ourselves, nothing's going to change. We need that environment to change, and we need the parent to be able to take the role that they should have as a parent.
So a research team got together and developers got together, and we developed the Common Sense Parenting Program. Well, the number one benefit that parents say to us is it gives them a step-by-step approach to being able to discipline their children in a positive way. So it's an excellent program for really giving parents the tools, the parenting tools they need in everyday life.
Boys Town Hotline is really one of our best programs, and we reach out to over 150,000 people every year. Last year, that hotline interrupted 600 suicides in progress, over 600.
In fact, whenever families are facing challenges, you'll find Boys Town working to keep kids and parents safe, keep children healthy in their homes and in school, and keep families out of the system.
The more we do this, we realize that we cannot do this alone. So what we do is we try to spend time in each community listening to the community leaders, to the other organizations there, to the children and families themselves, to find out the challenges that they face and the problems they're having, and even their vision for the future of their community.
Boys Town's ongoing efforts are making a difference around the country, especially in schools, which are the epicenter of the lives of kids and parents. One such school benefiting from Boys Town's support is Innovation High School in New York City.
Innovation High School contacted us and let us know that they were having issues with children that were not attending school. And we realized very quickly that quite often kids don't go to school because there may be mental health issues within the home. There may be no parents present at all. Kids may be looking after their younger siblings. They could be out working. Kids could have drug and gang involvement. So we basically gave them a proposal that we would come in, and while they work on the education needs of the kids, we'll work on the needs of the family and the children to help them to be here and to excel in the academic setting.
This kind of approach mirrors what is happening right now in our community through Boys Town's partnership with Omaha South High School.
Our school partnerships, our agency partnerships, our relationships with the families and kids that we serve, and ultimately the community that we're blessed to be a part of, are so important, and that's what brings the mission alive here in South Omaha.
Here at the South Omaha office, we offer Common Sense Parenting, Parent Connectors, Care Coordination Services, and in-home services. We also have a program called PAS program, and that program is for students from South High School that have been suspended, and we help them get back on track academically, and we also practice social skills to help them be successful when they go back to school.
It is clear, however, that no matter what challenges they face, communication is key in helping children and families grow and heal.
Teaching model of Boys Town is very dependent upon a youth's ability to communicate, both to hear, to speak, to use language, to receive feedback and receive it positively. All of those things necessary. Communication is required.
So the Boys Town National Research Hospital was built to address communication disorders in children and help close the circle of care to address every aspect of a child's health and development. The National Research Hospital is also at the forefront of much of Boys Town's innovative research.
The next frontier for us at the hospital, it is that neurobehavioral. So there is now technology that allows us to better understand the functioning of the brain, not just the observation of behavior of a youth, but the actual biological basis for that behavior.
It'll be groundbreaking in the United States. It'll change the way every kid in America, and probably every kid in the world, is treated for mental illness in the next 5 to 10 years.
There is more work to be done, more children to be saved, and more families and communities to be healed.